We're going to kick it off. So first off, I want to welcome everybody to share great showing. Thank you so much for being here. In recognition of Suicide Prevention Week and all this being done by a collective group, by not only the Suicide Prevention Council, but everyone in public safety and everyone in community and human service. So I welcome you today, and there's a growing strength that's happening every day in suicide prevention. It's based in all the entities that we have in the council. And I wanted to just share a couple of things with you to let you know that we have a group that's pretty eclectic. We have first responders, we have human services, we have faith community, we have everybody that's important. And I think the best thing we can do is assure that we keep this topic, important, and we collaborate on it, and we make sure that we're talking about it. So a lot of thanks to our legislative partners. We have funding now for the SPC that we didn't have before. We're able to do things that hasn't happened before, and in my view, having been a long member of the SPC, we're bringing a lot forward and doing a lot of things that in my view, are very important. So not only is it the legislative means, but the governor's office, the governor and his staff have been unwavering in their support. So I really think we owe a debt of gratitude to everybody that helps collectively. And without further ado, I'd like to introduce the governor. And sir, thank you for being here.
Great, thank you. I appreciate it. I'm going to be very quick. When you talk about mental health, when you talk about suicide prevention, and we're really highlighting the opportunity to talk about awareness, to talk about prevention, to talk about families during Suicide Prevention Week, because it's not a week. It is every single day. We're dealing with families, we're dealing with kids, we're dealing with moms and dads, students, folks in the workplace, every single neighborhood, every single community. It's one of those issues that does not discriminate by income, it does not discriminate by where you live, and if anything, it's really been exacerbated. We know through the COVID crisis and kids being out of school, we've really tried to put a lot of emphasis on children and kids because we know that's where the risk is the highest for what's going on. We've done a lot here in the state, there's no question about it. We've made the investments in Hampstead Hospital, we're making another investment in a large mental health hospital. Our mobile crisis teams are huge. Those mobile crisis teams didn't exist a few years ago, and now really no matter where you live in the state, you do have access to some of those teams. We have our mental health agencies working directly with our hospitals. We're making sure that folks aren't waiting days and days and weeks in emergency rooms. I think at one time we had 70, 80, 90 people waiting in emergency rooms in the state, and we've been able to really reduce that number. We still have workforce challenges, of course, but we want to be the state that is putting an emphasis on this issue, that is putting an emphasis, not just we approved a policy and approved some money, we're putting the emphasis on the families, on the kids, on the individuals, because that's what this is about. Government can't solve all these problems. What we can do is create doors of opportunity for families so they have access, so they know what is available out there. The 988 national number now is huge. The fact that we put a mental health awareness and suicide prevention hotline number on the back of every student ID in this state, that's really exciting because it's not just about the students that have the access, it's about those families. We know that phone number is easy to get for every family member in the state who has kids in school. That's just an awesome opportunity, another door, if you will. What we don't want is to have a great system that no one knows how to integrate with, or a great system that has barriers. And there are so many families out there, so many individuals that had those barriers, didn't know who to call, didn't know where to turn, felt alone, they felt isolated, they didn't want to, they didn't have, maybe a kid didn't have that one trusted adult. And that's sometimes what every kid needs, just that one trusted adult that they can lean on, that can talk to about this stuff. So we're doing everything we can at the state level. I think we're making huge strides. I want to be the place that is known for putting the emphasis, that is making the investments and building new hospitals, because that attracts the workforce, right? I want the workforce flooding over here from Massachusetts and Connecticut and New York. I want all of that workforce saying, hey, New Hampshire's a place to be. And we do that by highlighting these things, not just doing blue ribbon commissions, but really making an emphasis. Not political, it's not Republican or Democrat, everybody is really involved. And I got to give credit across the entire board. Everybody has really been involved, from the stakeholders, our new 10-year mental health plan. I mean, let's face it, the 10-year mental health plan has now become basically a 3 or 4-year mental health plan. We have to redo it again because we've really achieved so many of those goals so fast. Still a lot more work to do though. There's no doubt, still a ton more work to do. I've talked too much. We're really here to kind of hear from families, hear from individuals. I think it's their stories that are far and away the most important. They're not easy stories to tell sometimes. We have a couple individuals here that are going to talk. And I just want to thank them. Anyone who's willing to get up and tell their story in the hopes that maybe one other family hears it, or one other kid hears it, or one other individual who has gone through this or is going through it today hears that story and knows, hey, wait, maybe there is a door here. Maybe there is an opportunity. Maybe there is a real brighter tomorrow. Because there is. Tomorrow can be great. We all go through tough times, but tomorrow can be great, right? It's not easy. It takes a village. That's that whole line. It really takes a village of families and schools and communities to really make this happen. But to hear from these individuals, I think, is one of the most important things we can do to highlight not just a week of suicide prevention awareness, but really the concept that it is a 365-day-a-year challenge and a critical issue that we all have to take on as individuals. Like I said, I probably talk too much. No one wants to hear from the politician too much. With that, do you want to step up, or who wants to come up next? I don't know.
So Jenny's going to...
Oh, Jenny? Okay, great. I don't want to go out of order. Great, I'll let Russ introduce Jenny.
Governor, thank you so much for those words of encouragement and again, all that you've done for mental health and suicide prevention. The partnership continues, and I think that we could not do the job we do in the SBC without direct help from the Health and Human Services Department, and we're very lucky to have Jennifer O'Higgins here to talk about some very important aspects of what's going on in mental health and suicide prevention.
Thank you all so much for being here today. We're so incredibly proud of all of the work of our state. Every day, life-saving programs and resources are being deployed throughout New Hampshire, serving individuals and communities, and they continue to strengthen over time. So although this past year has brought many challenges, we've also seen so much success recently. The National Suicide Prevention Lifeline just recently transitioned from a 10-digit number over to an easy-to-remember 3 digits, 988. So this change is bigger than just a phone number. It creates phone and text and chat access for mental health, for substance use, for suicidal thoughts, for emotional distress, and for overwhelm. So people really can call for any reason. Right here in New Hampshire, it's also a part of a crisis system transformation that includes call centers being able to dispatch mobile crisis response teams across the lifespan for people of all ages and in all regions of our state. These changes are able to help residents have that easy-to-remember number, but also have trained individuals to respond in person when and where you need them. So 988 is a national change. It's a rallying cry to change our country's crisis response. And it's brought about unprecedented funding and unprecedented policy change. In New Hampshire, we were actually able to start these changes even sooner than that national change when we stood up New Hampshire Rapid Response. New Hampshire Rapid Response is available 24/7 every day of the year. And again, Rapid Response can dispatch the mobile crisis teams throughout the whole state. So just from January to July, that Rapid Response Access Point received over 16,000 contacts and has deployed mobile crisis teams over 4,000 times. So New Hampshire really is moving forward and making incredible change to our system over time. And over the past several years, the Department of Health and Human Services has made some investments to strengthen mental health and substance use crisis across the state. We remain focused on implementing the 10-year mental health plan, which does include a renewed focus on suicide prevention specifically. We also work really closely with the Suicide Prevention Council to implement New Hampshire's suicide prevention strategic plan. We're focused on implementing the children's system of care and increasing capacity for our inpatient treatment, as well as building more community-based services, and ensuring that children, youth, and adults have access to behavioral health supports that they need whenever they need them. So in the simplest of terms, just to make sure we all remember how to access the supports we might need, we can all help to prevent suicide. We can take care of ourselves and each other. We can check in with our friends and neighbors. We can ask and listen and try to be non-judgmental, and then make sure that we understand the warning signs of suicide and be able to refer people to the help that they may need. And so when you need police or fire or ambulance, you know to call 911. When you're feeling overwhelmed, emotional distress, and struggling in a crisis, you call 988. And that's really some of our best resources here in the state. And so we're really thrilled to be able to have partnered with everyone to make sure that suicide prevention awareness is at the forefront of our minds, and that we're all connecting to the resources that we have here. Thank you.
thanks Jennifer, and thank you for all that HHS is doing to bring this forward and to bring all these good activities forward. Next, I'd like to just say a couple words. NAMI New Hampshire has spearheaded suicide prevention efforts in New Hampshire as long as I can remember. And having been part of the NAMI family and a past board member, I'm very proud to introduce the executive director, Susan Stearns, and give her just a few moments to talk about a lot of, well, there's a lot being done, but maybe a little of all that they do. So thank you, Susan.
Thank you, Russ. NAMI New Hampshire is a grassroots organization working to improve the lives of all people affected by mental illness and suicide through support, education, and advocacy. Last year, we served nearly 40,000 individuals, made possible only through the incredible work of our over 200 volunteers across the state. I tell you this because we are folks who are people living with mental illness or have a loved one living with mental illness or have been impacted by suicide. So these are the voices of people who have experienced these challenges in their lives and some of the challenges the governor alluded to in trying to navigate systems, as well as today we're going to hear about what the experience is for someone who has been able to access the rapid response. So thank you, Governor. I want to thank all of the policymakers. I want to thank the department, our partners in the community mental health system and the New Hampshire hospitals for bringing us to this point where we have this system here in New Hampshire. But I especially want to thank the hundreds, if not thousands, of advocates, individuals and families with that lived experience who helped advocate for the 10-year mental health plan, advocate for the funding for it, advocate for the rapid response, for statewide mobile crisis, and they did so by sharing their deeply personal and sometimes heartbreaking stories. We are here today because we stand on the shoulders of those giants. Rapid response and 988 is one of the most significant opportunities for us in decades to truly reevaluate the response to mental health crises and law enforcement's role in that response. What we are witnessing is a cultural change. Prior to January 1st and the implementation of New Hampshire's rapid response, families who had a loved one who was experiencing an acute psychiatric problem, distress, or perhaps first episode of a psychotic break for a young person in their family. They had really not very good options in many respects. One was to, if their loved one was willing, take them to the emergency department. The governor has talked about that could lead to long waits and challenges with accessing services, all of which we are working so hard as a system to address. The other was calling 911. As a family member, having to make that call when your loved one is experiencing psychiatric distress is one of the hardest decisions you might ever make. It's something that engenders fear that God forbid your loved one could become a statistic on the front page of a union leader, an interaction that goes horribly wrong and leads to tragedy for both the family as well as the law enforcement officer and his family. More likely, and one of the greatest tragedies of our mental health system has been that often that response to a first episode of psychosis or early serious mental illness has resulted in a family seeing their loved one leave their home in handcuffs or even shackles. Here in New Hampshire, we are indeed ahead of the curve in many ways. New Hampshire has made a commitment from the Department of Safety to Police Standards and Training to implement the gold standard crisis intervention team training for law enforcement, which in order to help ensure that law enforcement officers who do have to respond to people experiencing a mental health crisis have the training to work to de-escalate that, connect them with resources, and try to ensure that they get the help they need and don't wind up in handcuffs. The families that we work with at NAMI New Hampshire are so grateful for this and continue to advocate and There's going to be opportunities, many opportunities this year for CIT training for local law enforcement. We hope that we know that we'll see those classes full, and we look forward to that continuing. We also want to recognize that for our first responders, the experiences that they go through every day put them at some of the most great risk for suicide and other mental health issues such as PTSD. So we really strive through CIT to help take care of our first responders as well. So what we're talking about today is systems transformation. That on January 1st, indeed, our mental health crisis system in New Hampshire transformed. What is really remarkable is that systems transformation is transforming and saving lives. At NAMI New Hampshire, because we are folks with lived experience and it's part of our mission, we interact with people every day, individuals and family who they come to us because they may be having challenges navigating systems or they don't know where to turn. But one of the great things that we have is we form connections with these folks. And so we get to hear often from them about what worked, and about the positive outcomes. So I am truly honored, of course, to be here today with Governor Sununu, the Major, Jenny, all of you. But I am far more honored to have the opportunity to introduce to you Joshua Christopher Fontaine, who will share his own story of hope.
Hello, my name is Joshua Christopher. I want to thank you all for having me here today to talk about my experience using the new New Hampshire Rapid Response Team. The date was February 18th, 2022. It was roughly 9:30 p.m. My mind was filled with suicidal thoughts, feelings of being alone, and depression. Questions raced around in my head. Should I use the new New Hampshire crisis line? What if someone needs it more than I do? Am I wasting their time? With the help of a good friend, I was able to come to the conclusion that I was worthy of help. I contacted the New Hampshire Crisis Line by going to nh988.com, where I chatted with a very nice person. This person asked me the usual questions, wanting to make sure I was safe in the moment. They asked if I was suicidal. When given my answer, it was decided that it would be best for a mobile crisis team to come to my house. I was asked if this was okay, to which I replied that it was. When I asked if there would be police presence, I was assured the police would not be sent, rather a mental health evaluation team. I was told I would receive a phone call from the evaluators when they were on their way to my home. My mom, whom I lived with, was aware that I had contacted NH988 and was waiting for the evaluators to arrive. I received a call about 10 to 15 minutes later from the evaluation team, consisting of 2 people. They had arrived, but wanted to make sure they were at the right house before they knocked. When we confirmed they were at the correct house, my mom brought them to my room where I was waiting for them. They introduced themselves, and we discussed what was going on. I explained about my suicidal thoughts, feelings of being alone, and depression. It was then decided that I should go to the hospital, at least for the night, and then be re-evaluated in the morning. I was given the choice of going to one of 2 different hospitals. At this point, I brought my mom in and asked her to make that decision for me. I felt like even though I deferred to my mom for this decision, I had a true say in what was going to happen and where I was going to go. This made me feel like part of my own treatment team. When it was decided what hospital I would go to, the crisis team said they would leave. They let me know they'd call the hospital to let them know I was coming. Right before they left, I let them know I was feeling guilty. I was worried I had contacted the wrong people, seeing as NH988 was very new in February. They assured me I did exactly the right thing and that I had nothing to feel guilty about. My mom took me to the hospital where I waited about 5 to 10 minutes in the waiting room before going back. The staff was very nice. They knew why I was there because the mobile crisis team had called them. I felt so relieved to not have to share my story all over again like I'd had to in the past. The next day, I was evaluated again by 2 different people. One was an evaluator and one was a peer support person. It was decided that I would create a safety plan and meet with my peer support person weekly for a bit of time. At this point, I was discharged and sent home. I found the whole process from the very first chat on the NH988 website to the discharge from the hospital to be the smoothest I've ever had while being in crisis. I felt like I had more of a say in the decisions being made about my care. I appreciated being asked for consent before having people come to my house. In closing, I would like to encourage anyone who is struggling to please reach out for help. You are worth help, you are worth getting better, you deserve a life worth living. Thank you.
Joshua, Christopher, that was awesome. You are what everybody is talking about. You are the story that we want to hear. You are the person we want to see. So thanks for being here. Your courage, your ability is well beyond many of us in this room, and we would not be here if it wasn't for people like you. A couple of things just in closing. I want to turn it back over to the governor. But I think it's tough to talk about suicide prevention in 98 without talking about a giant that we've recently lost in the world of not only suicide prevention, but the world of mental health, and that's Cameron Ford. Cameron died unexpectedly, and we all felt it. And I think it's good that we recognize him today, that we mention him, because he was such a part of not only being the director of Headrest, which was the state's suicide prevention hotline, and still is an integral part of 988 and rapid response, but also just who he was. He was a first responder. He has never turned anybody away in need, and supported every effort. And the thing that I think stands out in my mind is not only the opinion, and I can paraphrase so many people that I've talked to, but that he was such a big part of getting this 988 and rapid response up. He was there from the very beginning, every committee, every commission. He was part of it. He was a driving force, and he knew what needed to happen. He knew what needed to happen because in all the years that he served others and put others before himself, he was able to bring it forward. So for him to know that this was happening is absolutely incredible to us. So I ask that you keep him in your thoughts and his family, and I also wanted to let you know that the suicide prevention conference this year, the SPC conference, is going to be virtual, November 3rd. You're all invited. The link will be going out shortly. We're going to be honoring Cameron even more for his life's work and hear from a lot more people. So I thank you, and I thank you for being on that team with Cam and being on our team. Governor?
Great. Well, I feel like I just want to close out by saying, I know you can't see it on camera here, but there's a lot of folks in the back. I see Mark Doyle from 911 here. I see so many advocates and folks that have been, and I see a lot of your faces. These are the individuals that testify, right? These are the family members, like Joshua Christopher, who have kind of shared that experience, and so I do appreciate everyone for actually being here. Like I said, this isn't a week of awareness. This is a 365-day a year. That story was amazing. You know what that tells me? That tells me the system can work, right? We just need people to know and have the courage to access it when they really need it. And we've worked really hard to not make it a government system, right? We're trying to create a system that wraps around your needs as an individual, where knowing that you're going through something, a real crisis. And it's your crisis, not every crisis is different. So we want a system that wraps around those individual needs. And that's what I love hearing about that story. It works, it's there, we want folks to access it. The New Hampshire 988 system is real. It saved hundreds of lives, and I think it can save thousands more. It's up to all of us to get the word out. So thank all you guys for making this happen. 365 days a year, let's not lose focus and lose track. Thank you guys. And we can take questions or whatever you guys want.